Lung transplantation is a gift of a new life. When patients need a lung transplant, they're very sick. They are not able to breathe, and their life expectancy is counted in months to a few years. Lung transplantation is an exchange of illness. Basically, you are exchanging your pulmonary hypertension for lung transplantation. Now the new lungs are going to be exposed to different types of illnesses. And over time, the lung transplant will eventually fail. It's just we're hoping to give you a longevity and a better quality of life. Most of the doctors are going to recommend that you undergo lung transplantation when your medications do not work, when they feel that you're failing medical therapy. That means that you are going to be maximized on prostacyclins, PD-5 inhibitors, endothelin receptor antagonists, and despite that, you're not doing well, and your 6-minute walk is poor, your biomarkers, that NT-proBNP, the echocardiogram, are not looking well. At that point, when the doctors refer you to a lung transplant center, you are going to be evaluated by many physicians. The process to undergo lung transplantation is arduous, it's long, and it requires usually 3 to 5 days of extensive testing. The lung transplant journey starts when you get a phone call that we have been able to find a suitable donor for you. At that time, we call you to the hospital. We make sure that nothing new has happened since last time we saw you in clinic. And we wait for that last phone call that the surgeons have seen that organ and that the donor organ is suitable for lung transplantation. At that time, we rush you to the operating room and the surgery starts, so that by the time the harvesting team brings the organ in, you're ready to have the connections of the lungs or the heart-lung at that point. Obviously, if you have any doubts about going through lung transplantation, you better have a conversation with your physicians, because remember, the turning down an organ at the last second means that potentially we may have to discard that donor organ that potentially can save somebody else's life. But it is true. Once you are in the hospital, you still can say, I don't feel comfortable with this decision, and stopping. You are always in control.